Hi, I would like to just clarify some issues regarding your upcoming surgery. Like all things, planning is very important. Firstly, it's important to plan for a level of inactivity after your surgery, as it will reduce any complications. For example, reducing mobility in areas which have had surgery, such as on limbs or back, and also avoiding excess water will certainly improve your healing and reduce complications. Therefore, it's important that before you have any surgeries that you have adequate cleaning, such as a shower and washing the area before surgery, and also it may be required that hair is removed from the site, and this is usually done by clipping, not by shaving, as this increases the risk of infection. Also of importance is alcohol. Alcohol is an immunosuppressant, and it does increase the risk of infection, and it also reduces the healing rate of wounds. Initially, post-operation, alcohol can also cause considerable bleeding, and it must be avoided, particularly for the first 24 hours after an operation. Smoking is detrimental to the healing rate of most wounds, and the evidence suggests that if you reduce or stop smoking 3 weeks before and after surgery, your complication rates can be reduced by a factor of 3. Medication is also important to review before an operation. For example, if you're on aspirin, Nurofen, fish oils, vitamin E, ginkgo or turmeric, then these must be stopped, as they will increase the risk of bruising. However, if you had blood thinners prescribed to you by a doctor, then it's important that you do not stop these unless advised by your doctor or the surgeon. Remembering that aspirin takes 7 to 10 days to get out of the system to reduce bruising and bleeding problems. Some of the areas of the body require extra attention regarding cleaning, and these include the scalp, the face, underarms and groin, and below the knees, as these are potentially higher risk areas for infection. You may also be advised to use some antiseptic soap and or antibiotics before your procedure. And finally, in preparation for your surgery, it's important to be prepared for pain relief after your procedure, and you should discuss this with your doctor, as different levels of analgesia will be required depending on the site and the nature of the surgery you'll be having. With all procedures, there are potentials for complications, and the complication list, as you'll be shown on this slide, highlights the common complications that we do have, and that includes infection, bleeding or bruising, scarring, or nerve damage. Some people get infections after operations, and the classic features might be some redness, soreness, or discharge from the wound 1 or 2 days after the procedure. Bleeding is also a consideration post-operation, and this can also be reduced by adequate rest and elevation immediately after the operation. And as mentioned in preparation, avoiding alcohol in the first 24 hours post-procedure. However, if some bleeding does occur, it's important not to panic. The principles of reducing bleeding are to put pressure on the area, elevate the area, consideration of some ice on the area, and in 90% of the cases, the bleeding will settle with those simple measures. However, if this is not occurring and you have considerable bleeding, either ring 000 for ambulance support or ring your doctor immediately to seek advice. There are some high-risk situations for bleeding. One is that a patient might have to have their operation while taking blood thinners. 2, an operation may occur in an area where there is a lot of blood vessels, particularly the face and scalp, but sometimes also on fingers. Therefore, it's important to understand, if you have an operation in these areas, that you have a great deal of caution with your activities. Also, some procedures will bleed after several hours when the anaesthetic wears off, and this is called a delayed bleed. And the reason for this is that when we use an anaesthetic, it constricts the blood vessels, and when the anaesthetic wears off, sometimes these blood vessels dilate and unblock the cautery plug that has been placed on it during the operation, and this may cause some bleeding. If this occurs, pressure, elevation, rest is important. However, discussing it with your doctor, as mentioned before, is important. With any procedure on the skin, there is potential for scar tissue formation. However, there are some high-risk areas of the body where scar tissue may form, and this predominantly occurs in the t-shirt area of the body as shown, particularly the front and back of individuals, and sometimes on the face, particularly around the ear lobes or behind the ears. And this is an unpredictable thing in that a perfect surgery can occur in this area, but unfortunately several weeks to months after the procedure a thickened scar may occur. This is often called a hypertrophic or keloid scar. The characteristics of an abnormal scar, such as a hypertrophic scar or a keloid scar, would be either itchiness, tenderness, redness, or thickening over the operation site. There are several things that increase the risk of abnormal scarring, and they include infection, hemorrhage, and trauma to the wound after the surgery. Some people have a genetic tendency to develop either keloid or thickened scars, and it's important to ask your family members whether they have scars that have thickened during procedures, or indeed if you've had procedures where you've had thickened scars in the past, as this unfortunately may be a feature of your healing process. There's also some unusual keloids that form on the face, usually behind the ears or on the earlobes, particularly in women who have had ear piercings. Some surgeries do have specific potential complications, and this is particularly on the face or neck. There are some sites on the face, which will be shown in this diagram, where there is increased risk of nerve damage if you have a surgery in these particular areas. There are high-risk areas of nerve damage on the face, and these include the temporal branch of the facial nerve, which is located in this area here, any surgeries here, and also the mandibular branch of the facial nerve, which is located here. Your surgeon will be well aware of these areas and will do their best to avoid doing damage to these areas. However, if the tumour is involving the nerves, then damage may be unavoidable. However, the risk of nerve damage is uncommon. There also may be potential for tendon and ligament damage in surgeries on the hand, but this again is also considerably rare, and with most skin surgeries, deep incisions into those areas is not usually necessary. Overall, if you have any concerns about any complications that you may have heard about or you may have thought about for your procedure that we have not covered in this presentation, please do not hesitate to contact your doctor and ask for advice. I have some examples of cases where things have gone wrong in the past. I've had on at least several occasions tradespeople who've been working in ditches or in dirty environments who have turned up for their surgeries in a complete mess, requiring particularly surgery on an arm, and we've cleaned it as best we can, but with the surgery there has been complications with infections afterwards, which has led to scarring and pain. I've also had one gentleman who we had to resuture 3 occasions with a lesion on his back because he kept going to the gym despite being told to avoid strenuous activity. He would break these stitches every time he went and did weights at the gym. And in the end, we had to just advise him that we weren't going to stitch the wound, we were just going to allow it to heal by natural intention. And so that's why it's incredibly important for the preparation. So if you are working outside and you're getting dirty and grubby, make sure you clean yourself well. Remove the hair from the site, particularly if it's the arms in a male where you may require some hair removal, and this will greatly improve the success of your operation.